Go ahead, John. Okay, guys, welcome back to Heritage Regenerative Medicine. This next gentleman has kindly volunteered for us to do a prolozone injection procedure. So this is a gentleman with chronic thoracic and lower cervical pain, and he has what we call T4 syndrome. Sorry. Somewhere around the 4th, 5th thoracic vertebra, when people get instability here, he's talked about like issues here and tingling down the inside of his arm. Now that could be neck, sure, but that can also be coming from the shoulder, and it does have some shoulder issues, so we're addressing that. But this is the most common area. So all I'm doing here is, these are very shallow injections. I don't need to go too deeply with these. I'm going from his lower cervical, 1, 2, 3. You okay, sir? Mm-hmm. Okay, sorry, it's a little tight there. Just putting a little bit near the ligaments in there, and then all we're going to do down the middle here is I'm going to grab some ozone, which I have in my pocket. Remember, ozone is just, thank you, an oxygen molecule with the extra oxygen atom kicked in when you use an electrical field, when you use electricity or ionizing radiation. Ozone has wonderful healing possibilities. It's anti-inflammatory, it's antimicrobial, it kills bugs, it boosts oxygen. A lot of that ozone goes back to oxygen. So this area will sometimes turn pink or red. And ozone in and of itself actually boosts something in your body called NAD. NAD is a molecule, nicotinamide adenine dinucleotide, which actually causes increased energy. And your body's energy centers in your cells use that. And your body's smart. The body will use, sorry, I know it's a bad one. The body will use NAD, or any kind of energy, for healing. So the majority of that, I'm just going to go back here because this is a bad area. The majority of the energy your body uses is going to be for healing. So I'm basically just, it's a gas. I'm just going to spread that around. And like I said, for this gentleman, at the top of that, just put a cover on this guy.
Okay.
Yeah.
This is empty.
Yes. I'm going to use it on the other one here. So for this gentleman, we have two areas. One is his, oh, you have another one? Thank you. We have his thoracic spine, lower cervical, upper thoracic spine. The other area is around the shoulder blade, because he's talked about some instability in this area. So I want to cover both. I want to be safe.
You're going to inject the shoulder?
Yes, if you just do me a spray up and down. Thank you. So what's this? This is for lack of a better, this is substrate. This is fuel for the prolozone. This is a combination of dextrose, natural sugar, like 50% dextrose. This is numbing med. This is anesthetic medication. A little bit of bicarbonate, which takes away some of the sting, the acidic sting of the anesthetic, saline to buffer it, and then some B vitamins. We got some B12 in there and some folic acid in there. And these are substrates or substances that the ozone can use to help potentiate its effect. So all we're going to do, same thing here. I know it looks like cherry juice. We're going to just subcutaneous. You don't have to go too deeply. Just kind of get in that area. Prolozone is something I will recommend and often do after I do prolotherapy or PRP or stem cell therapy. This gentleman has had prolotherapy done a couple rounds now, and we're seeing improvement. And this just helps to calm things down, gives that boost of oxygen, and helps potentiate the effect. So when you're in your own practice, you want to look at things that are going to make your procedures more successful for the patient's sake. It's one thing to inject people. You don't want to just inject people and leave them. And so when we're done here, we're going to do a little bit of red light therapy. And red light is very good for healing and getting blood flowing and calming pain down. So we'll do a little bit of that. And all we have to do now, you okay, sir? Okay, I'm going to do just a couple more, a little bit of ozone, and we're done. So there's a little numbing in there, so hopefully that's kicked in. And you'll see the skin will kind of blow up a little bit. It'll feel like paper mache, sorry. And again, you might see it turning like a little mottled red. I tell people that's normal. Your red blood cells and those little vessels under the skin are absorbing all that